Thank you for coming out today, and welcome to the Coffee Connection Networking and the Medical Care During a Pandemic panel discussion. I just want to go through some housekeeping. If you can, remain muted during this time. So on the toolbar, you'll see you're able to mute and unmute, if you could, to remain muted during this time. And if you would like, you can turn on your video. There is a chat box, and I want to ask everybody to go ahead and add your name, title, the company, and an email address or your contact information to the group chat. And if you go ahead and do that right now, you can share your contact information and connect with those that are on the call today. And at the end of the panel discussion, if you would like, you can go to the More button and save the group chat. That way you'll have all the questions, some of the comments, and as well as the contact information that people add to the group chat. So go ahead and do that now if you'd like. I also want to thank the chambers. We oftentimes, the chambers, we work together collaboratively to give our members an opportunity to expand their network. This is one of those, and what we have done today. Each of the chambers will have an opportunity to introduce themselves and talk about what they have coming up next. I'll start first. My name is Duke Abrahamson. I am the Executive Director for the Asian Pacific American Chamber of Commerce. Our members, oops, sorry, I apologize. I went ahead a little. There you go, sorry about that. Our membership consists of Fortune 500 corporations, multi-ethnic private business enterprises, and corporate professionals over a broad spectrum of industries. Our mission is to facilitate business between Asian and US-based companies. We cover, we're the collective voice for 30+ Asian and Asian Pacific countries, so that's quite a big and broad spectrum. We have strategic partnerships with the Detroit Chinese Business Association, Indo-American Chamber, Japan Business Society of Detroit, Korean American professionals in the automotive industry, the Philippine Chamber, Taiwanese Chamber, Thai American Association of Michigan, and the Vietnamese American Association. We're based in Southeast Michigan, but we do have members in Ohio, Chicago, and West Michigan. Along with networking events, membership levels include marketing, press releases, communication, member highlights, and our job board. I will put our website and contact information in the group chat for you. So I'm gonna introduce next the Birmingham Bloomfield Chamber. Joe, if you could introduce yourself.
Good morning, everyone. My name is Joe Bauman. I'm the president of the Birmingham Bloomfield Chamber. For those of you who may not be familiar with our chamber, we're actually a 6th community chamber. We represent the business communities in Birmingham, Bloomfield Hills, Bloomfield Township, Bingham Farms, Beverly Hills, and Franklin Village. Pre-COVID, we were about 700 members strong. We'll see what happens by next spring. We advocate on behalf of our businesses with politicians at the county, state, and federal level, making sure that their interests are well represented and at the forefront of legislation that gets proposed. I do have some staff people on the call. We're a team of 4. Kelly Bennett and Samantha Michalik and Cheryl Geralds are all on the call. I do want to mention that we do have a very important webinar coming up on Tuesday morning at 8 a.m. We are doing a virtual chat with the superintendents of the Birmingham Public Schools and the Bloomfield Hills Public Schools. Obviously, what's going to be happening with our kids as we return to school is of paramount importance, not only to our residents and parents, but also to the business community, because it has huge potential impact on people from dual income families being able to return to the office and work. So that is open to everyone. You can find information in the link on our website, which is bbcc.com. I want to thank Duke for putting this together, and our friends and good supporters from Henry Ford, West Bloomfield, for this morning's program. Looking forward to it. Thank you.
Thank you, Joe. Up next is the Chaldean American Chamber of Commerce.
Thank you, Duke. My name is Sarah Kittle, and this is Sana Navarette.
Good morning.
Hi.
Good morning.
We have our conference room set up for virtual meetings, so that's what we're using here. Can you guys hear us okay? Okay, good. So pre-COVID, we were over 1,000 members strong. We've lost a few, but we hope to get those back by the end of the year. We are an ethnic chamber. So we work with a lot of local chambers. We promote Chaldean, Assyrian, and Syriac-speaking companies and individuals. We work with them, but we also have 30% of our membership is non-Chaldean. So anybody who wants to do business with us, we will accept into our membership. We have not a lot of events going on right now, of course, but we do have a golf event coming up on August 20th. So Eric, we hope to see you there. So we only have a few foursomes left. It's a really, you know, anything that you can do outdoors and safely, people are looking to do. And because our dinner, which is 900 people, just couldn't happen this year, it's our main fundraiser for the chamber. So this golf event is kind of taking its place. And did you want to say anything,
No.
Sana?
Just thank you for having us be part of this, and we look forward to talking.
Thank you.
Thank you, ladies. Up next, we have Huron Valley.
Good morning, everybody. I'm Joelle Beether, the Executive Director with the Huron Valley Chamber. We cover Commerce, Highland, Milford, and White Lake. And we typically have about 450 members. And like all of you, we're hoping that that continues on through and that we can all get through this together. We are kind of integrating some live events back into the fold. We've been doing some coffee clubs and lunches out in the park. And it's been great to get people back together and see everybody live. And we have a coffee club tomorrow, actually, at 8 o'clock in the morning here at the chamber on our patio. And like everybody else, we're plugging for a golf outing September 10th. Fingers crossed that that can kind of help us out as well. We typically would be working on Milford Memories for this weekend, but as you know, we've all lost our big events, and that was a big hit for all of us here. So we're hoping that our golf can be a little bit of a fundraiser and get us through the rest of the year.
Thank you, Joelle. Waterford, you're up.
Good morning. I'm Nikki Tippett. I'm the Assistant Director of the Waterford Area Chamber of Commerce. We were playing with 600 members before COVID, but now we're probably closer to 550. But, you know, hoping to gain some momentum in 2021. We, like everybody else, are getting ready for our golf outing. It's next Friday, so we're really excited about that and happy to see some of our regular people. We've moved our coffees outdoors, which has worked pretty well. So, you know, just trying to shift gears and see what we can do. And we look forward to, you know, getting back to some type of normal and being able to figure out, you know, how we can work together and figure out how to get through everything. So thank you very much for having us.
Thank you, Nikki. And finally, West Bloomfield. Do we have somebody from West Bloomfield? Okay. I don't think we have somebody from West Bloomfield, or their mic is not working right now. So I'm going to move on. I'm going to show you a video, a quick video, and then we'll introduce the panelists. If you have questions for the panelists already, go ahead and add those to the group chat, and I will present those questions to the panelists.
Hello, I'm Dr. Betty Chu, Chief Quality Officer for Henry Ford Health System. As a national leader in healthcare for over a century, we have seen many challenges. World wars, the Great Depression, and numerous flu outbreaks. In fact, in 1918, Henry Ford Hospital treated many area patients who were suffering with the Spanish flu. And 100 years later, our entire team has worked tirelessly to make sure our patients are safe from the challenges of COVID-19. Although this is a scary time, we want to assure you that every precaution has been and will be made to ensure that your experience is both the safest and highest quality that it can be. We call it Henry Ford's Promise. What it means is that we are committed to making sure that every aspect of your care journey has been carefully thought through. The environments where you receive treatment are thoroughly cleaned and sanitized. The caregivers who are part of your team have been screened to ensure that they are healthy, and as always, they practice regular hand washing every time they interact with a new patient. The other patients who are also receiving care are screened and kept safely distanced from you throughout your time at Henry Ford facilities. New signs will guide you throughout the environment. Masks will be required for everyone entering our buildings, and if you don't have one, our team will provide one for you. Dividers may keep everyone at a safe distance, and overall, fewer patients will be allowed in our buildings at any one time. All of it is being done for your safety, and it's the reason we can confidently say, you are safe at Henry Ford. Yes, it may look a little different, but our Henry Ford Promise means that the care you receive is the same exceptional quality it has always been for 105 years.
Hey, Duke.
Yes, ma'am.
I just wanted to let you know Suzanne Levine is on, but she says she's just waiting to get in, to be let in.
I think she's on now.
Okay.
Hi, Suzanne.
Hi, sorry about that. I had 2 meetings at once and I clicked on the wrong Zoom.
That's okay. Did you want to introduce yourself?
Yes, good morning, everyone. And thank you so much for hosting this fabulous, very important, critical information for our community and our chamber members. As the Executive Director of the Greater West Bloomfield Chamber of Commerce, I'm here to help our community and support them always, but especially during these very, very challenging times. And I want to thank our strategic partner, Henry Ford West Bloomfield Hospital, for always supporting our chamber. Amy, you're amazing. And just very briefly, we have a huge event that I'm going to be sending out e-blasts and letting the community know in October. It'll be a virtual internet business event with different columns with health and leadership and community. So stay tuned for more information about how you can, be part of it.
Thank you, Susan. Oh, sorry, guys.
Hello, I'm Dr. Betty Chu.
Okay. I'm going to try this again. Let's see there. There you go. Okay, I'm going to introduce Eric Wallis. Eric assumed the role of the president of Henry Ford West Bloomfield Hospital in May of 2019. Eric brings more than 20 years of healthcare experience to the role. Prior to joining Henry Ford, Eric served as the vice president, chief operating officer, and chief nursing officer of Baylor Scott and White Medical Center in Grapevine, Texas. Eric begins his career in nursing and has spent the last 13 years in the hospital leading leadership roles, including experience with multiple services lines and hospital operations. He has diverse experience ranging from large academic medical centers to community hospitals. Eric is a transformational leader who understands engaging all team members through innovation and collaboration. He earned his undergraduate degree from Bowling Green State University, holds a Master of Science Administration degree from Central Michigan University, and recently received a Doctor of Nursing Practice and Nursing Administration from Texas Christian University. Oh. And then there is Dr. Chen. Dr. Chen is Chief of Medicine at Henry Ford West Bloomfield Hospital. She is also Program Director of the Infectious Disease Fellowship at Henry Ford Hospital, Detroit, and Associate Clinical Professor of Medicine at Wayne State University School of Medicine. She received her medical degree from University of Michigan School of Medicine and completed her internal medicine residency at Henry Ford Hospital, followed by an infectious disease fellowship at Wayne State University. Dr. Chen is an inspiring clinical leader who partners with hospital leadership to aligning operational and clinical efforts with the hospital. Dr. Chen served as the Section Chief of Infectious Disease at Henry Ford West Bloomfield Hospital for 9 years before becoming the Associate Division Head of Infectious Disease for Henry Ford Health System. She is a member of many professional societies and recently completed her term as Chair of the Graduate Medical Education Committee at Henry Ford Hospital. I think I've got it all. I'm going to pass it on to you, Eric, and Dr. Chen.
Great, thank you. I'll just start and make a few comments, and then really at the end of the day, the person that you guys most want to hear from is Dr. Chen, because she's got a wealth of knowledge on the topic too. First and foremost, I want to thank all of the chambers for inviting us and allowing us to have this conversation with you. I think it's been a year that none of us will ever forget. And as I've told many of our folks here within the hospital, we are living through a once-in-a-lifetime kind of pandemic. So it's been something that we've learned a lot as we've gone through this. Before I talk too much about that, I also want to thank all the chambers for all of your golf outings, because that means I don't have to work much in the month of August. You know, I get a chance to hang out with all of you guys, so we're very much looking forward to that. But seriously, I think our partnership with the chambers is crucial to how do we serve this community. At the end of the day, Henry Ford West Bloomfield and the Henry Ford Health System really exist to serve these communities, and so that's really what we're here to do. And today is just hopefully one piece of that. So just briefly, I'll give you a little the history of kind of going back to talking about COVID and what we've seen. We saw our very first patient that was COVID positive admitted to the hospital here on March 13th. I don't think I will ever forget that date the rest of my career. When you talk about the COVID pandemic and the response that we saw here in Southeast Michigan, I will tell you that when you look on a bed size, so we have 191 beds here at Henry Ford West Bloomfield, but by number of beds, we saw more COVID positive patients than any other hospital in the state of Michigan. And so that was something that we weren't necessarily ready for, but like I said, we learned a lot. I'm so proud of the team that was here. I'm so proud of the community that we are in, that we got through this in a way that kept our patients safe. And we can talk about a lot of different aspects of this, but one of the things I was most proud of is you all have heard a lot in the news about some of the concerns and challenges with sending patients who were COVID positive or COVID patients back into skilled nursing facilities, senior living facilities, et cetera. And I will tell you that we did that very successfully here in our community because we had a great partnership with those facilities. We had daily calls with the facilities that were around us and allowed us to have them know what resources we could provide to them, how we could partner together to keep patients safe and keep people out of the hospital. Because at the end of the day, what we wanted to do was keep those folks safe no matter where they were. It's been a neat event, an interesting event. So we learned a lot. I'm very proud of the fact that the first couple of weeks when we saw these patients show up, it was a brand new virus. No one in the world had really ever seen this, and we didn't know how to treat or care for these patients effectively, or even keep our own team members safe all the time. But after that first couple of weeks, we learned so much, and I would say even over the last 2 months, what I'm happiest about is we've not had a single one of our team members get COVID-19 from their work here at the hospital. So we've learned a lot of new protocols put in place. We've learned how to restart care. You saw in the video a lot of the precautions that have been put in place to keep patients and visitors safe as they come into our hospitals. Today, we test every patient who is admitted to the hospital just to make sure we know what their status is. We're very fortunate that Henry Ford West Bloomfield has all private rooms for our patients, so folks don't have to worry about being in a room with someone they don't know whether they're COVID positive or not. And our team is, like I said, we're very experienced with this now. Our clinics are doing great. We have seen great growth in telehealth services. So if you need to talk to your doctor, you don't even have to come into the building. You can do it right from your phone. And we've seen thousands and thousands of those visits successfully completed over the last few months. So just a little bit of introduction. Like I said, I'll let Dr. Chen talk and give you some specifics too. And then really what we want to spend most of our time doing is answering your questions. Because we know that, I was talking with some of our front door folks today, we know that we have a perspective on this whole thing that is very different than the general public because we lived and breathed it for about 4 months in the walls of this hospital. So we want to give you the information that we have and let you be able to spread that back to your members and give them good information and not just things that are maybe hearsay or things that folks have made up along the way. Dr. Chen?
Thank you, Eric.
And before you begin, I just want to remind everybody to go ahead and add your questions to the group chat, and I will deliver those to our panelists. Go ahead, Dr. Chen.
Thank you. Thank you for joining us today. You know, I've been a physician here at Henry Ford Health Systems for 20 years. I've been so proud to always represent Henry Ford and be a part of such a wonderful organization, but never have I been as proud as this year because, you know, COVID was a pandemic that the world has never had experience with before, and it was truly a crisis for all of healthcare. And in the beginning, no one knew how to take care of COVID. That's just the fact. There were no guidelines internationally by any organization of what was best to treat COVID. But you have organizations that kind of followed others, and then you had organizations like Henry Ford that sought to be leaders in figuring out how to give the very best care to our patients from the get-go. And what's so amazing is that Henry Ford was able to rise to the challenge. Our system was able to develop best care practices that we continue to employ. So, you know, some of the first things we did, as you probably heard in the news, we were the very first healthcare system in Michigan to develop and offer COVID testing. This helped to ensure that our patients got the quickest results, the soonest results, also protecting their families when they needed to quarantine. We continue to, for all of our patients that are part of the Henry Ford system, we continue to offer them tests and their results are back within 24 hours, which is very, very quick compared to most other places. We've made numerous discoveries, not just the hydroxychloroquine that you've probably heard in the news, but other even more important discoveries, which I can talk about if anyone wants to hear about later, that really have led care for COVID and actually have been adopted by most of the hospitals within Southeast Michigan, as well as the country now, some of the things that we're doing. I can tell you that, you know, being on the front lines, what I'm most proud of during our COVID, the greatest part of our COVID pandemic, when we saw the greatest numbers, is that in a pandemic of chaos across the world, there was no direction, you know, from the upper authorities of the government or even healthcare, you know, at a national or international level. At Henry Ford, what I saw every day was organization, calm, effective leadership. We had excellent communication, and we were able to provide our patients with the best care during this chaotic time. We've always had not just effective and safe PPE for all of our healthcare providers for the next day, but Henry Ford worked very hard with, you know, leveraging all of our relationships and our outsources, our resources. And so we were able to provide safe gear, safe, what we call PPE, for all of our employees for at least 100 days in the future. We were never living day by day, but we had everything planned out to keep our patients safe and our employees safe. I can tell you, I'm an infectious disease specialist. My entire division, we've got 15 to 20 physicians. We saw every single COVID patient, and not one of our infectious disease physicians contracted COVID. So that just tells you how safe Henry Ford is in protecting our patients and protecting our employees. And so that's some of the things, with all of this experience and all of these breakthroughs and cutting edge and really providing the best care for the last 100 years that Henry Ford is, we've learned so much during COVID. It's true that, on March, early mid-March, we didn't know half as much as we know now, but we quickly learned, we've quickly led the state and the country in providing some of the best suggestions for COVID care, and we certainly know exactly how to take care of COVID now. We've had numerous successful successes that have been published in clinical trials, actually 10 publications in the last couple months, all demonstrating things that other hospitals are now modeling. So that's really something we're very proud of. Treatments now, I'll tell you that we've been involved from the very beginning in the most available, promising treatments. In addition to probably the hydroxychloroquine you heard about, what wasn't made as prominent in the news, probably because of political reasons, that it wasn't as exciting to, was that, we were involved with remdesivir, which is another drug that highly successfully treats COVID. And so we have many other options that we're using at this time to treat COVID that have been proven to save lives, such as this medication called remdesivir plus steroids in patients who are very critically ill. So we certainly are employing the best treatment. The treatment that we use at Henry Ford is actually what's being used at almost every other hospital now in Southeast Michigan, as well as most major academic institutions across the United States. So we're certainly, at the forefront of that. I think a major question is that many patients, many people in our cities and many of your businesses are probably wondering is it safe to come to the hospital? Should I maybe put off that clinic visit or that well visit or my annual checkup with my doctor? There's a concern, could I potentially increase my risk of being exposed to COVID? And the answer is absolutely not. It's actually far more dangerous to put off any health care. And let me explain to you why. It is safer to enter and be at a Henry Ford Health facility, whether it's a clinic or a hospital, than any other indoor public space, such as a grocery store or even a restaurant. And I can tell you why this is. There's so many precautions that our healthcare system puts in place that are not routinely put in every grocery store that you need to go to buy your groceries. So we've really worked hard to ensure that this is the safest space for every one of our employees, every one of our patients, every one of our visitors. Some of the steps that we've taken, because we want you to feel and know that this is the safest environment you can be in, short of quarantining in your house and never leaving your house, never letting anyone in your household leave your house. This is the next safest space you can be in. And I'll tell you what we do. We screen with questions and with temperature checks every single visitor who enters into our doorway, whether that's every employee, every patient, all of their caretakers. There's no one who enters our property without having a thorough screening. We require everyone, as Dr. Chu mentioned in her video message, to wear masks, and we provide them if they don't have them. We require social distancing and we even have decreased the numbers of patients allowed in at one time. We've even spaced out clinic visits, starting some clinics as early as 7 a.m., going to as late as 7 p.m. in some cases, opening some clinics on weekends. We've done all of these things so that we can space patients out so that we don't have multiple people waiting in a waiting room. So we don't have that issue with not following safe social distancing. We've got numerous infection control experts who've gone through every inch of our hospital looking for every possible improvement that they can maximize the safest control of any spread and prevent any spread of infection. As Eric has mentioned, not only do we screen every patient being admitted to Henry Ford for COVID with a COVID test, we also do that for anyone undergoing a procedure or surgery. Again, to keep all patients safe and everyone around them safe. Of course, we employ the best practices with environmental safety. You know, in a hospital, the airflow and filtration system is going to be far superior than your average building. So, you know, in short, to summarize, with all these special precautions that are being taken here in our clinics and our hospitals, truly, there's nowhere safer you can be if you're in an indoor setting outside of your household. Because most places can't and don't do everything that I've just described every single day. And that's why my 85-year-old parents, you know, they asked me, is it okay to go to my annual visit? And I said, absolutely. And all of these, you know, their colonoscopy and their mammogram, these are all crucial because what we've seen and what's been published in the newspapers, in major scientific journals, people are misinformed and they're afraid that there's increased risk to be exposed to COVID by entering a healthcare facility. So they're putting off these crucial healthcare needs. In some cases, patients have disease that's known, like diabetes and coronary heart disease and hypertension, that's not being controlled the way it should be. And so they're putting off their doctor's visits because they're scared. We have other cases where people are putting off routine screening. And what's going to happen is we're going to miss cases of cancer that could be caught early and could be life, you know, saving to come in early, get treatment at an early stage versus waiting half a year or a year, and that could make a marked difference in how patients are doing. So I would urge you and, you know, everyone that you know, please share with them how safe it is to come into Henry Ford, you know, our clinics and our hospitals, because everything we're doing here has ensured that safety. We want you to know you're safe and we want you to feel safe.
Yeah, Dr. Chen, I'm sorry, I would just jump in and say, obviously one of our big partnerships is with our local emergency management systems. So both here in West Bloomfield and Farmington Hills are probably our two primary organizations that we work with. And unfortunately what they've shared with us is that they have seen as much as a 40% increase in the number of EMS calls that they've gotten where they show up. And unfortunately the patient has passed away before they get there. And so we know that folks have had, you know, heart attacks and strokes and some of those things in their homes and not been, and been afraid or unwilling to come and call and ask for help. So we really are trying to stress that. You've seen a lot of that in the news, but it's reality here in our own community that you've seen, you know, a 40% increase in unfortunately deceased on arrival runs from our local EMS. And so that's something that we really want to change and why we want to have this conversation.
Absolutely.
You know, the other thing I did see in the chat, and I apologize, I'm jumping in on Duke's job here. Folks, someone asked the question, is there really a second wave coming? And what I would tell you is we're not out of the first one yet. And that's really the concern that we have is that I think, and Dr. Chen can express this more, I'm very concerned that we're going to fall into very soon into a flu season that's going to be compounded by this COVID wave that we're still in. And how we're going to manage that volume of patients as they come into the hospital. So I would love for us to be able to start talking about how do we manage a second wave as soon as we can actually get out of this first one.
Thank you, Eric. And that's just to echo what he said. Locally, statewide, nationally, we've been seeing these numbers and these reports. So many people becoming critically ill and even passing away because they were too scared to come in for help. And sometimes just a small symptom is the only red flag someone will have that there's something that needs attention. And again, screening and getting a well check and an annual visit and your normal screening procedures are our way of staying ahead of the game. So any postponement of all of these, quote, normal things that we used to do 1 or 2 years ago really need to be continued. And we understand as a healthcare system at Henry Ford how crucial this is for our patients' health, and that's why we've gone and, you know, done everything possible to make sure this is the very safest environment you can be in, you know, in every aspect. And so that it absolutely is so crucial for everyone to continue to keep up on their medical care. The last, go ahead.
I have a question in regards to testing. The question is, this person has been in contact with somebody that refuses to be tested but exhibits COVID symptoms. Can they go and get tested? Where can they get tested? And should they even go and get tested? They are not exhibiting symptoms themselves.
Okay, so that is a tough question, but I think my advice as an infectious disease specialist is they should assume that it is very likely that the person that they were in contact that is exhibiting, you know, very classic COVID symptoms could very well have COVID, which means this person should assume that they have potentially had exposure to COVID. Now, without symptoms, we are not necessarily recommending testing at this time. If they're a Henry Ford patient, they could discuss it with their physician to see if their physician would recommend testing. We definitely would recommend, I would recommend that person stay safe, potentially quarantine if possible for up to 14 days. And this is why I would explain that. They could have already, if they had been tested on day 1 of exposure and tested negative, that only tells you for that single day you were negative. You still have the potential to turn positive for the next 14 days. So a negative test at the very beginning, right after exposure, does not mean you're not going to turn positive and start developing symptoms in the upcoming 14 days. And actually, I have personal experience with this. I've been asked on many, many occasions when someone has had a situation exactly like this, an exposure. We had them tested, they were negative, and then 7 days later, 10 days later, 12 days later, they turned positive and exhibited symptoms. So, you know, having a negative test on day 1 or day 2 does not take you out of the woods or ensure that you're not going to develop symptoms in the future. So for your safety and for the safety of your friends and family around you, I would really try to be extra cautious for these next 14 days since your exposure, in case you develop symptoms. And for a little bit extra knowledge, it definitely exists. There's a fair amount of people with what we call asymptomatic COVID. They may feel only slightly poorly, or they may not feel any symptoms, but they carry COVID and they can transmit COVID. So even if you don't exhibit symptoms, that doesn't mean you couldn't be what we call asymptomatic COVID. So again, safest situation is, trying to really stay safe for the next 14 days and quarantine and not having any close contact with anyone around you for the next 14 days as well. And also, yes, and I'll leave it there.
Yeah, I'll just add, one of the things that is the very most important thing that all of us can do to prevent the spread of this disease is wear a mask. And there are lots of myths that are out there in the world about, whether they do this or they do that. I'll tell you a couple of things and let Dr. Chen add to it. We know that when both people are wearing a mask, the chance of transmitting COVID is exceptionally low. It's just been proven, it's scientifically proven, it is the #1 way that we're going to slow the spread of this disease. The other thing I think that comes up as a common myth is that there are folks that can't wear a mask, that somehow it's going to, harm you to wear a mask, et cetera. And that's just not reality. The best example that we can say is even within our own building, we have people today that are wearing masks 12 hours a day, 14 hours a day, very successfully. It doesn't inhibit the flow of oxygen. There are people that may have a medical condition, certainly something that they should discuss with their primary care doctor to figure out what the right strategy is. But for the vast majority of the population, the most important thing that we can all do is to wear a mask.
And I see one question I want to clarify right away. It asked, did I say that none of the staff in the entire hospital contracted COVID? That's actually not what I said. So thank you for asking that question. What I was mentioning about contracting COVID was that all of the entire infectious disease physician department, we have, close to 20 infectious disease doctors at the main campus and here at West Bloomfield. We saw, the highest numbers of active COVID patients because we would go into each of these rooms every day to examine the hundreds and hundreds of patients in all of our hospitals with COVID. And we, as the infectious disease doctors, none of us contracted COVID over the last 4 months. And we've been tested numerous times because we are part of different studies and this and that. And so I was specifically talking about all of the infectious disease doctors, all 20 of us who literally examined, 500 COVID patients who are critically ill. None of us did contract COVID. And that was because we were wearing masks. We were staying safe. We were wearing the PPE Henry Ford provided. And as Eric mentioned, and it's something that I've been advising everyone, including the Bloomfield Hills School District and other places, the masks are by far the most effective way. If everyone can wear masks all the time, outside of the household, it will go so far in helping to decrease our exposure and our numbers. I see a lot of people just not taking it seriously enough. They kind of have the mask hanging below their nose. That's actually has no benefit if you have the mask hanging below your nostrils. It really has to be above your nose bridge, tight above there. And it's so important to wear these masks. And it's unfortunately why in our country, we're 4 or 5 months out from COVID, and we're at across the country, we're at our highest numbers yet. It's not going down the way it is across the rest of Europe and Asia, where it's just chugging along, and we're not doing a good job. And it's because we don't have the entire country wearing masks all the time when they leave their household. And unfortunately, we're only going to hurt ourselves. It's only going to cause COVID to stay in our communities for that much longer, until we can all get our acts together with that.
Yeah, and I would add just to add to that question, we did have about 3% of our team members that contracted COVID-19 across this entire event. We know that a number of those folks in those first 2 to 3 weeks were exposed because we were learning about how to do this. And what I'm really proud of is that over the last 2+ months, we've had none of our team members get COVID from exposure at work. And so as we've learned about this, and as we know more about the virus and how it's transmitted, we've been very successful. But like I said, out of 2,000 people, about 3% of our folks that were COVID positive or exposed in the early stages of this pandemic.
Okay, I have another question here. What is the greatest hurdle you're encountering with aftercare, whether it's COVID or non-COVID survivor patients?
I'm sorry, you're asking what are the biggest challenges with aftercare in COVID patients? You mean how they're doing after they have the disease?
I will assume yes.
So with COVID patients, it's a unique disease, and there's a wide range of how people do. You have the asymptomatic people, you have the people with mild disease, but once you get into moderate disease, especially when it starts affecting your lungs, we see some people make a full recovery, but we see some people who have coughed for a long time, and even a very small amount of people who continue to have difficulty breathing, and their lungs seem to have been damaged, potentially even permanently, and they're needing oxygen for weeks and even months. So there's still more information that's needed. And again, most people make a full recovery. I think anytime you have someone who's more elderly or debilitated and they're hospitalized for weeks at a time, you've probably had or heard that they often need to go to a nursing facility or skilled facility to get physical therapy and get their strength back. Because, even if they were walking and independent beforehand, anytime someone who is critically ill for an extended period and is hospitalized and in bed for a very long time, they need some extra physical therapy and conditioning to get back to where they were. And so that's not unique to COVID. That would be true for any, life-altering event. If they had a stroke or a heart attack and, was, critically ill for a long time, so that is something we're seeing as well. I'm not sure for non-COVID patients what they were, if someone could clarify what they meant by non-COVID patients aftercare.
While we're waiting on that, Kim, do you guys have an opinion on kids going back to school?
So
I'm gonna let Dr. Chen take that one.
I have two children, one in middle school and one in high school. So I definitely am very vested in this question. There's no question, just April, May, June, being out of school and doing, virtual remote learning, it's not the same. It's hard to be as engaged. The complete loss of the social aspect is very hard because socialization is a very big, important part of our society and our culture. I think that, for the majority of population of kids is very tough to begin with. And then I'm worried that for some kids who are maybe don't have as strong a support system or networking system and friends, they're even more socially isolated. And I think it's very devastating for some, even a smaller proportion of kids. They might be feeling depression or, having all of the effects of just being socially isolated. Clearly, we would like in-person to resume, but we can only do it if we can be safe about it. And I see one of the questions is another surge coming? And as Eric pointed out, we're not out of the first one yet, but what I can say is what we see across the country, the more exposure, the more contact and public exposure people have with each other, especially if they're not wearing masks all the time and following social distancing, it's increasing cases of COVID. We see that when businesses were opened, right before businesses were opened in Michigan, we actually were at our lowest point of COVID. And then after businesses opened in Michigan, which I understand why, we all have to survive and there's an economy. But that's when we started seeing a spike steadily rising every day since we opened businesses. Michigan has had more and more cases. That's just the fact. And I hope that schools can do it safely. They'll need to be at a very minimum, keeping 6-foot distancing in classrooms 100% of the time between students. They'll have to require their students to wear masks 100% of the time. And if those two things can be followed, I think it can minimize the risk of COVID transmission. I would anticipate, though, that the fact is that if you go to school and there's 1,000 kids at school, are you going to have a little bit more risk of being exposed to COVID than if you don't go to school in person? You will have a little bit more risk, but that's just a decision each family needs to make for themselves. Is how important is this in-person learning to me and my student, and is this a risk I'm able and willing to take? Do I have very, very critically ill family members or patients, family members who are what we call immunocompromised? Are there special reasons that this doesn't make sense for me? So I think it's an individual decision, but I think that there's no question that there's some baseline rules, such as masking all the time, safe hygiene, desks at least 6 feet apart in every classroom 100% of the time. That would be minimum starting point. Temperature checks, screening for the kids before they come into the school. These would be all things that I think would be non-negotiable.
Yeah, I would just add, I think that one of the challenges is that the data on how kids react and transmit COVID-19 is still pretty limited. If you think back, and one of the great things that was done was that the schools were closed when the pandemic kind of took off. And unfortunately, what that means is that a lot of the kids have never been exposed out to the public. So they've been kept home, they've been isolated. And so, some of the most recent data that has started to come out has shown that kids over the age of 10 can transmit COVID and get COVID just like adults do. But it's small data sets. And so I don't know that we really know what the risk is to our kids yet. And so I would agree, I think, with Dr. Chen. The reason you're seeing so many different plans from different school districts is because they've got different buildings, they've got different capabilities. And I think what's going to be hard is each one of those school districts is going to have to decide what is their capability of keeping kids in masks and keeping them socially distant while providing those services. So I don't think you're going to see a one-size-fits-all answer for all of our school districts.
Absolutely. The data set is small, but the data in the last month from the pediatric population is suggesting that children can contract COVID as easily as adults. It's suggesting at this time they might not get as critically ill, but that's still to be determined. But they certainly are testing positive currently at equal numbers and spreading it as well as anybody else. I think some of you may have seen that YMCA, I think was it in Georgia, that was released, a news article that's been making the news the last 3 days. There was a camp, a sleepaway camp, YMCA sleepaway camp. Hundreds of children within 2 days of entering that camp contracted COVID. They all, hundreds of children tested positive after coming away from that camp. So there's no question that it's that they certainly don't have any superpowers or immunity to not contract COVID, and certainly they spread it among themselves very, very quickly. So I think it's safe to assume at this point that children, are not. We shouldn't assume that they're less susceptible to getting COVID or spreading COVID compared to an adult. I think would be reasonable to say.
I have a question here. What COVID myths have you come across, and what do you find hilarious in regards to what's spreading in social media?
Oh, I will be the first person to tell you that I have turned off all news sources on social media because I think, frankly, it gets frustrating. Because I think that that we live in a world where people can share any thought that comes into their brain out there in social media, and some folks take that for granted or take that for literal, and other folks get into big arguments about it. So it's really, I would say, not worth wasting the energy on. I think what's really important is to stick with what is the science. Around this virus. And I put into the chat box for everybody, Henry Ford, we've got a great page, henryford.com/coronavirus, where it has the latest facts, the right things that you need to know. And so I really would just encourage everybody, go to reputable sources, the CDC, the World Health Organization, henryford.com. You're going to get good information there that doesn't come with some of the maybe injected thoughts or biases or things that may not be true. And probably the most important thing I can say is, if you've got a concern, if you're not sure what to do with yourself, your family member, have a conversation with your primary care physician. Reach out to them. We've got the ability to do telehealth or video visits. You can get those questions answered really quickly. But yeah, right now our social media world and our news media world, there's a lot of things that you got to be careful about. And I've debated whether to delve into this one or not, but we've made a lot of news even at the Henry Ford healthcare system with our study about hydroxychloroquine. And the unfortunate thing I think about that is that the hydroxychloroquine gets the headline, but there's a lot more to that study than what you see in the headline. And the reality is that we saw in a retrospective study that when you use a combination of medications for a very specific patient population, it reduces mortality. One of those medications that was in that combination was hydroxychloroquine. So it's not as simple as what folks want to make it all the time. And so asking additional questions is really important.
Excellent. Yeah. And I would say the biggest myths are the masking importance. That's probably the single most important thing, is if everyone wear masks. And I think the other thing that may not always be accurately portrayed in social media is how serious this infection is, and that rates across the country are actually continuing to increase. There is no control of this, you know, across the country as a whole. We certainly know how to control it at Henry Ford, and we know how to give best care. But I think as a whole, you know, we continue to have thousands of cases across this country every day, and it is spiraling out of control. And so I think those are my biggest concerns. And I think we really need to all come together as a country and understand that it's not one political party or another. It's just, there's only one, you know, science is science, and we just want everyone to be safe. We want everyone to be safe so we can get back to, you know, getting rid of this pandemic, so we can go to life as normal and as well.
I have a question here. For individuals who are unable to physically wear a mask per sensory reasons or past traumas, what accommodations are being made to provide adequate care?
So I'll jump in on this one. So the good news is when we have those patients that present to the facility, because we have fewer visitors in the building, we have fewer patients in the building, we're more spread out. So we have places that we can actually take those folks straight in. You know, have them, if they need to wait, they can wait in a space that doesn't have other people in it. We have the ability to you know, kind of get them into a space that they don't have to be exposed to others as well. So those patients, again, they're very few and far between. What we've trained a lot of our screeners to do is to have conversations with folks when they come into the building, not just about, you know, put a mask on or else. It's really about, let's talk about why. And if it's truly somebody who has one of those issues or one of those challenges, we have ways to deviate from our normal care path in a way that keeps them safe and keeps everybody else in the building safe.
Any last comments from you guys? I think that's it for our questions today. So I just want to get some last comments from Dr. Chen and Eric. And thank you for joining us today.
I was going to add one thing that I didn't get a chance to address. I see in the chat room someone asked specifically, what are we doing to treat COVID in our patients who are hospitalized? And I did want to mention, in addition to the hydroxychloroquine, which we use in combination with steroids for our very sick COVID patients, at the same time in March, we were one of the only institutions in Michigan that was chosen to be part of several remdesivir trial studies. And there's been a lot of excellent scientific data now that's been published on the good of how, of decreasing mortality, improving outcome, saving lives with remdesivir. So specifically, you know, we've continued to evolve, and what Henry Ford uses now, and again, we were one of the earliest to use it. We were part of the trials, multiple trials in March with the remdesivir. So actually for a long time now, Henry Ford's been using in our critically ill patients in the hospital, remdesivir and steroids. And again, that's what's used across most medical centers across Michigan in addition to the United States. So we were one of the first involved in those trials. We were able to show that benefit. And so again, everyone's talking about the hydroxychloroquine. We've moved on past that for a long time, actually. So we're using something else now that's been proven in medicine to be beneficial and has been adopted by the other hospitals as well as across the country. So that's what we've been using. But just to piggyback on that, I think people have sometimes asked me about the vaccine trial. So you may have heard about the Moderna vaccine COVID study. There's several vaccines being developed, and the reason vaccines are so important, there's only two choices about COVID. Either eventually we're just going to keep going on for the next decade until everyone gets hit with COVID, or we need to find a vaccine that's effective that can help prevent people from developing infection with COVID. And so, you know, developing an effective vaccine is our country and the world's best hope of trying to save as many lives as possible. And so that's why vaccines are so crucial. And we're the only medical center in Michigan that was chosen to be part of this vaccine study. So we're very grateful for the confidence that was shown to Henry Ford. It is a I think maybe Amy can post a web link online for anyone who wants to read about the study. This is what we call a phase 3 study. Phase 1 and phase 2 have already been completed with over 600 patients in other locations, proving the safety of the vaccine. So the FDA has already said this vaccine is safe, and in phase 1, and then in phase 2, this vaccine was able to prove that people formed antibody against COVID. Now we're part of phase 3 of the study, and the purpose of our study, because it's already proven to be safe, now we need to know if it's effective. And so our part of the study is to determine if forming the antibody will actually help prevent you from getting COVID. So that's the main focus of this study now. Is it's been proven safe, this vaccine, so is it effective? If people take this vaccine, will they actually not get COVID compared to people who don't take this vaccine? So that's the main focus of this phase 3 trial. It is a long study. They're asking if you do participate, it's a 2-year commitment with multiple visits. So it's not a one-time visit. So for anyone who wants to read more about it, we're really proud to be part of the future of trying to find the solution and basically the cure. How do we prevent more deaths? How do we prevent people from getting COVID? We need to find an effective vaccine, and we're proud to be a part of that.
So I'll jump in. I saw the question about, has it been determined, if once you get COVID, are you immune, or can you contract it again? I think the answer is we don't know. And that's the unfortunate thing is, again, this is a virus the world has never seen before. And so to Dr. Chen's point, although we are working like crazy to try to find an effective vaccine, what we don't know yet is this going to be like, measles vaccine where you get it once and you never have to get it again? Or is this going to be, like the flu shot that you have to get it every single year? And so that's why the study and the science is so very important to us, so that we can figure out what the effective treatment is and what's the right way to do it. That's also why you're seeing multiple types of vaccines being developed, is because one may be more effective than another in having long-term protection for folks who get the vaccine. So that's the hard part about this whole treatment, and why we talk about second waves and some of these others, because the reality is we don't know yet. And what we're trying to do really well is prepare for making sure that we're ready for whatever comes next. What I said, I feel so blessed to be part of the Henry Ford Health System, because we're not standing out there on an island. And as Dr. Chen mentioned, some of our partnerships with business have been phenomenal. And I'll point this one out because I think we have to with the Blue Oval. The Ford Motor Company has been an amazing partner for us. Not only developing PPE, but also donating space in a warehouse in Dearborn, where today we have sitting over 100 days worth of all the personal protective equipment that we would ever need if this comes back in full force again. So we are very prepared for whatever comes next, but what the answer is, we don't know what's going to come next. So we're trying to prepare for everything.
Thank you so much, you guys. I want to thank everybody and the chambers for being here today, and thank you to Eric and Amy for making this all happen. I want to let you know that all of the links and all of the information is in the group chat, and you can copy and save that. We will make this video available on YouTube, so all of the pertinent links and information will be in the description below. And thank you so much for joining us today.